welcome to Let's Just Do This. I'm Margaret Wallis-Duffy, and I'm always happy to be sharing this soulful table with my co-host, Todd Miller.
Soulful conversation, that's what we do here at Let's Just Do This.
We do indeed, and you know what, we have to give a shout out to one of our previous guests for coining that.
Yes.
Jamie Fitzpatrick, thank you for that, because...
It's royalties. I think that's what it's about.
Is that what it's about? Yeah. You know, the reality is we are about having real conversations with real people doing extraordinary things to really help educate, empower, and inspire you and your family to live well. And so today I am really excited, as I always am, but extra special people are sitting across from me today. I've had the pleasure of working with one of these individuals, and I feel like I already know her sister just through the stories that Miranda has shared with me. So it is with great pleasure that I introduce two incredible pharmacists that aren't just like any old pharmacist. These women are tireless advocates for integrative medicine. They are tireless advocates for putting the patient at the center and for living well. Miranda and Sherri Tawfik, the owners of Origins Pharmacies, and guess what? They're mothers, they're wives, they're business owners. They run 5 pharmacies, one inside the Oakville Hospital. Ladies, welcome to Let's Just Do This.
Thank you so much for having us today.
You know, Miranda, I had the pleasure of working with you on one of our documentaries on eye health, Inside an Eye Health for Seniors, and we brought our cameras right inside that beautiful new facility at the Oakville Hospital. Thank you to Oakville Hospital for allowing us to do that. When I walked into your pharmacy, I was blown away, because it doesn't look like a typical pharmacy. It looks like something in Europe where you walk into this beauty buffet of wellness and well-being. And then at the back behind this gorgeous wall is where the medication is, because yes, we will need that eventually. Yes, we do need that sometimes in acute care. But what your focus is in empowering and educating people to live well so that they don't necessarily need the medication. Shut the front door.
Whoops.
That is such an incredible concept to me, and you're living that. Could you, Miranda, start off the discussion? Actually, Sherri, you were going to start off the discussion. Why integrative medicine? You have a story to tell, your own story, and we love stories here. Let's talk about your story and how Origins is what it is today because of it.
Okay. Well, yes, our career did start with a story, a personal story. I consider actually a privilege to have had a little run-in with my health very early in my career. Shortly after I graduated, I was diagnosed with papillary thyroid cancer, so basically thyroid cancer.
Wow.
And mine turned out to be one that was quite refractory to like simple treatments, and I had 4 surgeries over the span of a few years. I also had a complication to those surgeries, ended up in a tremendous amount of pain. Now I'm well connected. I have a family of physicians. I was already kind of in the field, and I got exemplary care from the perspective of getting rid of the thyroid cancer. I had severe pain of all kinds around the time, and I was seeing world-renowned pain specialists who were taking care of me to the best of their ability, no question, and prescribed a tremendous number of pain medications, let's say, so opioids, seizure medications to help control the pain and kind of make my life, make the pain more tolerable. As I mentioned, I was early in my career. The side effects of the medications, they made me drowsy, they made me dizzy, they made me feel worried about addiction, they made me down, and it was not part of my plan, let's say, okay? This is not how I wanted to start my career in my life. So with a lot of help and a lot of work, and my sister very much so. She was already a compounding pharmacist at the time. I was working as a clinical pharmacist in the hospital with a very limited view on pharmacy at the time. And so she helped me get topical pain medications to help to avoid those side effects. We together were kind of resourcing acupuncture, special pillows. It took massage therapy, physiotherapy, I can't even think. So we were navigating all this from scratch. And it took, like I said, about 5 years before I kind of had control. That control allowed me to continue to live my life. I held on to my job, despite that pain specialist recommending that I go on disability because he was all out of options. Wow. It just was not part of my plan or my desire. Nobody asked me what I really wanted. They said, you have pain, I know how to treat your pain. And that was the end of it. You had cancer, we got rid of it. And I'm grateful for that, no question. But it was like there was an understanding that that should be it, that should be the end of it. That's, like I say, I call it privilege in terms of how I started, because when I left the hospital to come into community practice on my sister's direction, or let's call it invitation is the better word, I happened to work in a pharmacy where they had an ear, nose, and throat specialist, where a lot of patients were being treated for the same condition as me. So thyroid cancer was growing, lots of young women, and I was able to see firsthand how my experience and all that research and all that work that we did for selfish reasons was able to help so many other individuals. And that's where it all began. You don't have to. It helped me realize what it is that we need to do as healthcare providers, as advocates for patient and wellness, is to see the person for who they are, what they want, what are their goals. And we may not have all the answers as just the pharmacists, but we can navigate the system for the patient. We can help them. We can help them think about what it is that they want from their life and facilitate that for them. And that can only be done by collaborating with the whole teams, whether not just healthcare professionals, but social workers and families and caregivers, and you got to be part of, you got to connect with all of them. And so that's really what that is. That's where that started.
You said it took you 5 years to gain control. Did you feel during that process that your questions about your health or your desires to try different things were maybe not listened to, maybe?
Oh, absolutely. They were questioned, they were stifled every step of the way. It was very clear that everybody kind of knew what they knew. And this is not to judge them, but we're only limited by what we know. So the surgeon, who was a renowned surgeon who did a fabulous job for me and used nerve-sparing techniques, no doubt did a good job of cleaning me out. And told me and made the recommendation that I shouldn't use narcotics because he has seen, the addiction. Then my pain specialist says, well, this is how I know best to treat, pain, and it includes narcotics and seizure meds and blah, blah, blah. And I know you're feeling kind of down and drowsy and sedated, but, most people don't work under your conditions, so just don't work. Like, do you have to work? It was like that. So each person kind of knew what they knew, but didn't really know how to work with me and work collaboratively.
Not cohesive at all.
And that's why it took 5 years. It was first finding the like-minded people who could kind of get the whole picture, and then, it was not cohesive at all. And that's, like I said, I start with my story, but it's so many people's stories.
It is indeed.
We have seen too many of our patients share entirely different conditions, entirely different issues, but the same kind of story. And it's very frustrating. It's very hard to navigate alone. It sometimes feels futile, because you just keep getting those barriers that you were just suggesting.
And this is coming from you, a person with knowledge, and you admitted that you have connections.
This is it.
I feel the same way in my own journey, and as you said, and I truly now in hindsight believe that my own health struggle was a gift, because I meant to be on this planet to help others, and I was young and strong enough and could surround myself enough. But we need to be the voice for those that don't have the connections, those that don't know what their options are, and recognizing that we're better together. And this isn't putting down the conventional medical community. I just want to say how much I respect the way you delivered your story, because you gave praise to the medical professionals that did their incredible work to save your life.
They did.
But you're also, I want to give praise to you for being your own advocate, and I know you didn't do it alone, but digging deep within, even as Todd said, when people are saying, no, you're crazy, just stop, quit your job. The mental, physical, emotional, and what about the spiritual side of wanting, this wasn't your plan, you said so beautifully.
Right.
I just want to thank you for being so honest about your story. And as a role as a pharmacist, where there's a lot of judgments, I'm sure you both have, especially nowadays, people are more informed. I'm not saying medicine is bad.
No.
But I'm saying, like you said so eloquently, they don't know what they don't know, and we've only got so many things in their toolbox.
To the best of their ability is what you said, too.
That's exactly
right.
Yep.
Thank you.
Unbelievable. We're going to be taking a break in a couple of minutes, but before we do, can you set the stage, Miranda? I know you've said this to me, and it made such perfect sense. I always say that you're such a different type of pharmacist, and I think you're phenomenal, both of you. We want, and I know your goal is to have all pharmacists think this way,
Yes.
and that people will search out a different approach to their health. You said to me there's something different between, and doctors don't even understand what true integrative care is when it comes to being a pharmacist. Can you just set the stage for our discussion after the break?
Again, it's really about pharmacists don't know what they don't know. So it's the same concept. We're taught when you leave school, medications. So you just learn the medications and you learn the side effects. But you don't realize that these medications, one, cause further, perhaps disease, further side effects, that maybe there are options that we may not just know. Maybe they're not in Canada, maybe they're practicing in the States. So I've always wanted to take it upon myself to learn, to grow. And you can only do that with other professionals. So the knowledge that I've gained is working collaboratively with physios, pelvic health physios, naturopaths, massage. I want to understand because I can only do what I know best, but I can be a resource to so many others and work collaboratively. So integrative, it's very intuitive to us in our practice. It's not something that, for me, requires much thought or even defining. It's what should be practiced every single day.
Sounds
in
like common
healthcare.
sense.
For me, yeah, but again, we know
I mean, it's common sense for you.
it's always been. I mean, I think definitely watching my sister struggle in the beginning of our career, because we graduated at the same time, and I was always trying to come up with options. Then you read acupuncture is a phenomenal way to relieve pain. Okay, let's do that. Okay, naturopathic medicine, let's do that. Okay, let's find alternatives to, opioids. And 15 years ago, opioids didn't have the same issue as we do now, as we know now, but we knew there were problems with it. It shouldn't be, for her, it was not the go-to. So it's really intuitive medicine. We want to start practicing healthcare and wellness. So when you're looking at a patient instead of a disease, it's very intuitive to me.
Wow, I think that's a perfect segue. We're going to take a quick break. When we are looking at a patient, a person at the center, not the disease, then it's intuitive. Sit with that for a minute during the break, because when we come back, we're going to talk to both of these incredible women about the work that they're doing in the trenches with real people making a real difference with things like pain and mental health and opiate use, linking arms with other healthcare professionals and truly being change makers. That's what we do here at Let's Just Do This. Stay tuned. We'll be right back.
Welcome back to Let's Just Do This. I'm Todd Miller along with Margaret Wallis-Duffy and our amazing guests today, pharmacists. And you have 5 pharmacies, I understand.
Yes.
They're called Origins, and they're in a couple of hospitals in this region. What I don't understand, and I'm sure a lot of people have this, what is a compounding pharmacist? What is the difference between that and a traditional pharmacist?
Okay, well, that's easy. So a traditional pharmacist will get a prescription from a doctor and fill the prescription according to what's commercially available, right?
Okay.
So that's just standard pharmacy practice. What I've been doing for over 15 years and just love doing is making medications from scratch. So basically, I'm tailoring medications based on your needs, based on Margaret's needs, based on my sister's needs. So for example, the pain example, when my sister was experiencing a lot of nerve pain, she was taking oral meds. They were making her drowsy and dizzy, but it was very local pain. And so we did the research, we know what works, so everything's evidence-based. It just might not be available here in Canada. And we formulated a cream that had 4 different ingredients to work 4 different ways to help deal with that pain. So that's custom. So basically you're taking actives, formulating them, and working very closely with all sorts of practitioners to find solutions. So individual solutions.
So-
Commercial meds are, very limited in terms of dosing and so on. This is tailored.
And as you said, it's tailored for each individual,
Yes.
and it's almost like a hyper-local treatment where it doesn't
Yes.
go throughout the whole body. It's just intended to treat one little area.
That's right.
Very
That's
cool.
right.
It is amazing, actually, and I've actually had compounding medication from your pharmacy as a menopausal woman at a very young age and not wanting to take hormone replacement. It has been a game changer in my life. But it's something that you really do have to seek out. And I think that's what's incredible about the work you're doing. Can you speak to the tireless work that you're doing inside the hospital walls? Inside the hospital walls, where sometimes I'm sure it's not always met with a smile.
No.
But I know that you're making inroads and
but, yeah.
tremendous difference.
It's not met with a smile because, again, a lot of what we do is maybe new for them, but we're dealing with a wonderful administration who does believe wholeheartedly in integrative care.
Love it.
That I can say confidently, and we're so happy working with them. Now, in terms of work, Sherri and I won the bid a few years ago for the Oakville Hospital, and we wanted to be inside the hospital because we know that, again, being a patient and then being discharged, there's so much confusion, so many potential medication errors, and we wanted to be able to streamline patient care as much as possible. So from the hospital and into the community. So we have worked to, with the administration. Also, there's a lot of, government cutbacks in the hospitals. So how do you provide exemplary care and have cutbacks? So let's use our resources. So we know that we have resources. So we really adapted in terms of providing compounding in case there are medication back orders. We're licensed vendors for assisted devices programs, so home healthcare equipment and supplies, which is really important. And we found that in the patient's best interest, they don't want to go to 4 different places once they leave the pharmacy. So to provide a kind of health refuge before they leave, and knowing that we can even follow up with them at home, was really important to our patients. But I think on a larger scale, we can really help our burdened healthcare system that way too.
Yes.
So that's really how it started, and we're continuing to work, and it's again, and I think fairly new, and so we're growing with them. But I have to say, we're met with a lot of we were the new girls in the beginning, but we're met with a lot of acceptance now.
Love it.
Yes.
And you're now in Milton as well.
Yeah,
You're in the Milton
yeah,
Hospital, the new
that's
Milton
right.
Hospital, which is
Yeah.
fantastic.
Yeah.
And I'm just going to share a little bit about Miranda. She's relentless. So what she will sometimes, and this is not an exaggeration, she will chase a physician that she recognizes down the hallway that she's been trying to reach out to on behalf of a patient who's been maybe ignoring her calls because he assumes it's a sales call. That's what they're thinking about. Pharmacists is coming to them as, how are you going to support our business? They're thinking it's sales. They think of you almost as a rep of sorts. And so she'll chase them and say, you're ignoring my call. I know you think I'm trying to sell you something, but your patient so-and-so is struggling with this, and I think I have a solution. Will you give me a few minutes? And she, one by one, converts them.
I love it.
It is pretty amazing.
Well, what's amazing about it is that, it's bubbling up inside of you as your why, and you just
My why,
you just exude that when you work. I have to tell everyone, I had a family that I know, a friend in Brampton, but her father lives in Oakville and had a horrible time with the rash. This lady went to his house and not only did a medication audit and helped, but gave him a compounding topical that was a game changer for him. The fact that you cared about patient-centered care enough, that you went and did that when I just picked the phone up, speaks to the character of the human being that you are and the professional and your dedication to integrative health. Thank you for singing her praises, like she doesn't always. And that's what's so cool about this. Now, speaking of which, not singing praises, we need to have a heart-to-heart discussion because I know the incredible, tireless, dedicated, exhausting work that you're doing with mental health and the opiate crisis in our communities. This is not an easy topic. No. This is a very complicated one, and you are in the trenches, making a difference day to day with patients and their families. Can you please speak to some of the stuff that you're doing? Because I don't think, we know about the crisis, but I don't think we really hear the true story of what's really going on. And here, that's what we want to talk about.
Yeah, I'll try. I'm not sure I have, or anybody really has a good handle of everything that's going on, but I mean, it's not much different than the example that you were saying about Miranda having to go to that friend's home to identify the issue and deal with the problem. I find we've been servicing individuals with mental health and addiction issues for maybe 15 years now, and it changes regularly. And they're challenged by a number of things, highly vulnerable because of their health condition, because of their social status and their financial abilities, living in group homes, sometimes living independently. It is really hard to care for those patients, in my opinion. It was, again, my experience behind the counter or in the pharmacy. I found you get a glimpse, but you don't get enough of the story. And so going to them, these are people who may or may not think about coming to visit pharmacy. They're often, many of them, rejected from medical practices, either because of their mental health condition, have hygiene issues that doctors will say they're full when they're not full, and walk-in clinics and that kind of thing. And when you think about it, it's I don't know what word to use other than, just really heavily disappointing. If somebody had an infected ulcer or a wound in there and it happened to smell, would you ever worry about it being rejected from care because of that reason? But that is what a lot of my patients suffer from. That's where this started, I would say. Again, I feel like I'm a historian here. I'm talking about where things started, but it started with that. So first, identifying that gap, I found there's no way that I can continue to just give these people their psychiatric medications, keeping them out of hospital, without ensuring that they get ongoing medical care. And it was about begging and pleading and collaborating with physicians, nurses in the community who were like-minded, who had something in their heart that wanted to do the same thing, and bringing those physicians to them and working, like promising to work side by side in that kind of collaborative environment to care for them. We have too many heartwarming stories about patients' lives changed. People who were in and out of hospital with ineffective treatment or unable to stay on their antipsychotics, let's say, and so are going in and out of hospital on a regular basis, who, because the physician, the pharmacist, and the nurse come and visit them on a weekly basis and talk together and kind of just make them feel like the center of the world, which they are well treated, happy. Now, before it used to be like almost non-communicative. Now I can't show up without a big hug and a "where's my coffee?" Sometimes it's as simple as bringing some coffee, and having those conversations, and has not been in hospital yet, and for the first time ever is being treated for other underlying medical conditions that were ignored for years. Because of that lack of access. That's one of hundreds of just stories I have had the privilege of experiencing. And then you keep going from there, and you want to talk about opioids, and that is a big part of mental health and addiction, opioid addiction. Obviously, it's made the news a lot lately, but even prior to that, it was something that was unavoidable. Like, you could see it. We saw it brewing. We saw it happening. I'm very happy about the availability of naloxone now to help at least save lives temporarily while we work on the bigger issue. I'm a little bit disappointed about my colleagues' let's say, less than ideal uptake of what can be done for naloxone. Even with that, I find we can do a lot at the dispensary. Every time an opioid prescription is being prescribed, to initiate that conversation. You can't always wait for someone to ask for it. You need to let them know that they are at risk, the same way you would offer an EpiPen to somebody who maybe has a history of allergies but has never tried this medication before. It's the exact same concept, but again, I say it's not enough. So connecting, it's not just about connecting with healthcare professionals there. I've learned so much from working with social workers and caregivers at group homes and community organizations. You'll get a whole other perspective that you would have never had the opportunity to before. So it's linking with them and joining, going out into the community and meeting people who otherwise would have never come to visit you, and you can make a difference.
One show is not going to be enough for these two incredible
No.
women. There's just no question your passion, your dedication, and commitment for integrative care and linking arms so that we're better together is admirable. It's really creating a benchmark that I think so many need to take a listen. And I know both of you are just coming directly from your heart. There's no question how bright you are, but to be honored enough to sit across the table from both of you and to be able to have you on our show as well as our other documentaries, you're changing lives of families because of what you're doing. And I just want to, on behalf of Todd and I, thank you both for that.
Thank you. We're certainly trying, but
Yeah,
I
but we need
appreciate
help.
that. We need help. We
I
certainly
hope you'll
do.
both come back, because this was not, I'm
We'd
sure you
love
all
to.
agree out there, and I would love to have you back. And as you've heard here, if you want to know more information about Origins Pharmacy, please go online and check them out. These issues are real. Breaking down of silos in our healthcare system and putting the patient at the center is paramount for all people from all walks of life. No matter what your socioeconomical situation is or what your age is, we need to work together for a better Canada and for a better healthcare system. Our healthcare system is doing incredible work, but we together can make it even that much better. Thank you for joining us on Let's Just Do This.
Thank you so much.
Please share this podcast and television show with as many people as you know, and of course, reach out to us. We want to hear what you're doing in your community to make a difference, because I know there's so much incredible work being done across our country. So on behalf of Todd Miller, our entire team here at Your TV and Let's Just Do This, as the show is called, Let's Just Do This, these two ladies were the perfect example of putting their passion into action. And it's inspired action like that that saves lives and makes a difference in the health and well-being of all of us. Until next time, it's Margaret Wallis-Duffy and Todd Miller. Be well.